Cases are going down in the country, but it is a different story in other parts of the world. In the United Kingdom, authorities are keeping an eye on a subtype of the Delta variant that's causing another surge of infections. We're joined now by CNN's Salma Abidelaziz, joining us now live from London. Salma, thank you so much for joining us on The Final Word. Is the UK concerned about this AY.4.2 or the Delta Plus, that it is spreading quickly than the dominant Delta variant?
So at the time, Rico, scientists, researchers are working on sequencing that specific Delta plus subvariant. It's important to remember these viruses, as you know, they mutate, they change all the time. Most of these changes are inconsequential, but in certain cases, when you're talking about the Delta variant, the Kent variant, those were obviously highly transmissible. Now, what we know about this variant so far here in the UK, this Delta plus variant, is that according to local media, it is present in about 6% of cases. So it's not that high. And so far, it does not appear to be more highly transmissible. So what that means is, for right now, it is not a variant of concern, which is the labeling that's given when it's a worrying variant. But the UK is still experiencing a huge surge in cases. One of the biggest surges we've seen since the summer was occurring last week. And the real debate here is about, what do you do about the surge in cases? How does the government begin to bring those numbers down and make sure that the National Health Service doesn't become overwhelmed?
And of course, Salma, the caseloads of infections here in the Philippines have dropped significantly, and the economy is now opening up after almost 2 months of lockdowns due to the Delta variant. How is the UK government now handling the situation? Is it reassessing the lift of lockdowns and containment measures?
Well, the UK government is insistent that it will not change restrictions, at least for now. Their focus, their strategy is on getting more people vaccinated. And they have 3 key categories of people that the health officials here want to see get immunized as soon as possible. That's 12 to 15-year-olds, so the very young. That is an area of concern. They want to see people get vaccinated there, the very young getting vaccinated. Also, those who are vulnerable, ill, or over 40, they're supposed to go out for a booster jab. The Prime Minister this weekend had a call to arms. Anyone who's in that category needs to go out and get that booster jab, says the government. And of course, a very small category of those who are still unvaccinated. So essentially, the debate here in the country is that the Prime Minister and his government say, yes, we see a surge in cases. The solution to that is to vaccinate, vaccinate, vaccinate. But at the same time, you have doctors, nurses, representatives of the medical community saying, this is too much to handle. We need to see a change in behavior. You mentioned how the economy has reopened. For you here as well in the UK, everybody is out and about. Masks are not mandated. COVID passports aren't required. And that's the concern here. Doctors and nurses want to see some big behavioral changes so they can curb these numbers, Rico.
And briefly, so these rising cases in the UK is not a warning sign for the rest of the world?
Well, it's very difficult to predict how these numbers move and how this will transpire. But if you speak to doctors and nurses, they will tell you, look, if you have people who are testing positive, and last week there was a period of 7 days in which there were more than 50,000 new cases per day. And at the same time, you have a country that's fully reopened with one of the biggest airports in the world. It's absolutely a concern, Rico.
Salma, thank you so much for joining us on The Final Word. That was CNN's Salma Abidelaziz joining us from London.